Hi, my name is Dr. Michael Lee, and I practice in Indianapolis, Indiana. My practice is made up traditionally of spine and disc cases. So these are patients that have bulging, herniated, degenerative disc, sciatica, stenosis, both in the lumbar spine and the cervical spine. With the OMNIWave, I've actually been able to treat outside of the spine as well. So I've been treating, I've treated a thumb, a shoulder, knee, hip, elbow. So yes, with the OmniWave, I've been able to open up treatment to see other things outside of the spine. What challenges was I facing or looking to solve when I decided to bring on the OmniWave? Well, of course, new patients is always a factor of things that the problem that we want to solve. I had known for a while that I wanted to get into shockwave, so I shopped around. I did my research. I spoke with all the sales guys. I spoke with all the engineers. I spoke with some coaches, and I decided that OmniWave was the best brand for my practice. Number one, because it's the physics of it. It doesn't hurt. So I've gotten treatments from other devices, particularly the SoftWave, and the SoftWave was not a very comfortable treatment. And my coaches and mentors were like, "Hey, the OmniWave is a better device because it doesn't hurt." And so that was a big factor of I wanted to use this, but I also wanted to start treating other things outside of the spine. Like I said, joints. So we do a lot of knees, a lot of shoulders, a lot of hips. But really the big problem that I wanted to solve was I wanted to start treating neuropathy. I don't have my protocol yet for neuropathy, but that's on the horizon with the OmniWave. Compared to other shockwave devices on the market, the OmniWave is best in class. It's mobile. You can take it to events or fairs or vendor things, which I have done, as opposed to some of the other devices. They're not very movable. They're not very mobile, but the OmniWave, you can take it between practices, which is great. But how I've come to understand it is the way that the physics of the device is designed is that the shock wave, when it propagates, the rise time is almost perfect. Some of the other devices, the rise times are lower, and when the rise time is it's not as fast, and that's like with a radial device or some of the other focused shockwaves on the market. It's not the treatment can be painful, but with this, it penetrates your body at such a speed that it doesn't hurt. And that was a big thing because I've gotten treatments done with the SoftWave before, and it hurt. And I'm a 32-year-old triathlete, and I said, if the SoftWave is that uncomfortable when I'm getting a treatment done, what are my 65-year-old grandma patients going to think? They're not going to be able to tolerate that very well, and they're probably not going to want to be able to come back. So the OmniWave was a great choice because it's mobile, the treatment, it doesn't hurt, and it's just a great looking device. And one of my mentors, he's done $1 million with the OmniWave. He's done $1 million with the SoftWave, and he's done $1 million with the StemWave. And he said the OmniWave is the better machine. It's the better device. So I followed the recommendations of my mentors and coaches and decided to go with the OmniWave. I'm no stranger to buying equipment for my practice. I have 3 DRX 9000s. I have 2 class 4 lasers. And so it's always the manufacturer is saying, "Hey, we're going to give you all the support, and we're going to do everything on the back end." until you buy the device, and then it's like you don't get any support on the back end. And OMNIWave was true to their word. Logan was the sales guy that I dealt with, and he was fantastic. Before I bought the device, after I bought the their unboxing experience was annoying at first. It's like, hey, let me just open the machine and let's get it going. But OMNIWave did a great job of being diligent and said, no, let's open the device together. Let's make sure you have all of the pieces that you need, all the parts, is anything damaged? And they literally walked me through step by step by step. And I got the device delivered on a Thursday, and my first treatment was literally the next day, because they had given me enough to start using the device. School is great. There's the platform where people can ask questions, and there's protocols in there. And so the support on the back end, I've been really happy with how OMNIWave has supported me post purchase, unlike some of the other manufacturers haven't been so friendly on the back end. What I like working with the OMNIWave on a day-to-day basis is it works, right? I've often said that the OMNIWave has fundamentally changed the way that I view pain, and it's a cheat code. It is literally a practice cheat code, where there are so many times that patients come in, they're dealing with pain and they're frustrated and they've tried all these things, and it really sells itself. And I say, hey, let's do a demo treatment. We called a mapping session in our office, and let's see if you're a candidate. If there's not an immediate change, you're probably not a good candidate. It's not going to work for you. And it's pretty amazing to bring somebody in like a knee, and we have them take the stairs. I have pain. We do the treatment. My pain is less. Like, there's an immediate change with it. And it's a really attractive thing about the OMNIWave, is that it's so effective. It's so powerful. The treatment is painless. And like I said, I view it as a cheat code. And for all of my difficult cases, the OMNIWave is a part of the treatment protocol, and all of my patients love it. So the best response to the OMNIWave that I've had, I had a patient, she's been a long-time maintenance patient for her spine and disc. She went and got a stem wave protocol done, spent about $4,000 on a stem wave protocol, did both of her knees, and she came in for an appointment, and she was really hobbling around. I said, hey, how's your back? She said, my back feels great. My knees are shot, and I need a replacement for my knees. And so we were talking about her knees, and I said, what other types of things have you done for your knees? And she said, oh, well, I did the stem wave. I said, oh, really? I almost bought the stem wave. And she said, yeah, it's expensive. It didn't really work for me. And I said, well, what's your pain level at now? And she said, oh, my pain's at a 9. And I said, wait a minute, you spent $4,000, went through their whole protocol for an office here in town, and your pain is still at a 9? And I said, let's go. Let's just try it. So I said, hey, I want to do a demo treatment for you, and let's just see it. And literally, she was like the second or third patient that I'd ever done. I really didn't know what I was doing yet. And I said, hey, let's just do it. And so we did a OMNIWave treatment on both of her knees. That visit, her pain went from a 9 to a 2 immediately after. She walked 2.5 miles that night, and it lasted for 3.5 weeks. And so far I've done just a handful of OMNIWave treatments with her, and she said, I'm a believer in the OMNIWave. And she's gotten, like I said, a handful of treatments for her knee. And it's amazing when you have these chronic pain patients, they've tried everything, and they get off the table and they're like, wow, there's something different. Another patient, he actually had a dislocated shoulder. They were thinking about doing surgery. He was going to physical therapy, and it was so locked up, so painful. He couldn't move it at all. And so I said, hey, let's try the OMNIWave. And 2 weeks later, he went back to the surgeon and they said, "What are you doing for your rehab?" And he said, "Oh, I'm doing this thing called the OMNIWave." And the surgeon had never seen somebody recover so quickly from that type of injury before. And so they said, "Well, I want to see how this goes, because if this works that effective, then I'm going to be sending all of my patients to get the OMNIWave done." Yeah, so I shared some stories about my knee patient that had got a stem wave treatment done and then got the OMNIWave. I shared a story about the patient with the shoulder. I have another patient. She, as a spinal disc patient, has been dealing with hip pain, and she's about halfway through her protocol. And I said, "Hey, how's your hip going?" And she said, "I don't have any hip problems anymore." And I said, "Oh, surely there's something." And she said, "No, zero. My pain was very limiting. I couldn't stand up at church. It was difficult to walk, and I have zero pain now." And I was shocked to the point I said, "You don't have to lie to me. Like, you're not going to hurt my feelings." And she said, "No, seriously, I have zero pain." I have another patient. He's an HVAC guy, so very manual worker, and he was scheduled to have his knee replaced. And I told him about the OMNIWave, and he said, "Well, I'm going to give it a shot, but I'm still going to have my surgery." And I said, "Okay, fine." So I got the device March of 2026. His surgery was scheduled for a month later. And a couple visits in, I said, "Hey man, how's the knee?" And he said, "I canceled my surgery." And I said, "What do you mean you canceled your surgery?" He said, "The OMNIWave is working so much that I canceled my knee replacement surgery." And so it's pretty cool that this early on in the process, patients are experiencing long-term healing, and we're already canceling surgeries with it. How quickly did I see a return on my investment? Pretty quick. I wasn't quite sure of the protocol, how I was going to develop my protocol, but I hired a coach, Dr. Tony DeCesaro, Acuity Consulting. He's the preeminent shockwave expert in the United States. He wrote the protocol for OMNIWave, for SoftWave, for StemWave. He's taught for both companies. So he's got a shockwave accelerator sprint program, and I invested in his program. So we started to develop our protocol, how we were going to do it. And before we officially launched it to our patients, I was using it in conjunction with my spine and disc patients, and as that regenerative component of that. And so I got this in March, and then I started to add on to my spine and disc cases, which increased my ACV. With Dr. Tony's sprint, he was the one that recommended I get the OMNIWave. We did a 2-day sprint, and we generated 35,000 in our launch day. The great thing about the launch day was we spent $0 in marketing. We just did it for all of our existing patients. We started to build an interest list of patients that had other things that were going on and wanted to see if this would work. And we did our launch day, and we generated $35,000 with our launch day. And we've had the device for date right now is May 15th, Friday, May 15th. Our launch day was March 22nd, 23rd, the end of March. And in a March, April, May, so in a 2-month time frame since March to now, we've generated $84,000 with the OMNIWave. So it's pretty incredible when you use it correctly and use your patient base to market to, which is free. But it's pretty amazing that I was able to pay off the device in such a short amount of time. What surprised me most about the OMNIWave was the results, right? The money's great, the patients are great, the testimonials are great, but it's the results. Like, the OMNIWave I get such amazing results with it. It's nothing short of amazing. And I was surprised of how fast and how effective it was going to work. I would say what surprised me was the maintenance side of it, right? Like one electrode lasts about 100,000 pulses, which that seems like a lot. And we went through one electrode in two weeks. So we did 100,000 pulses in two weeks time. And I'm like, wow, like I didn't think that it was that of a consumable. But when I switched my mindset from the maintenance is an expense, as opposed to, no, the more treatments that we do, the more patients we're helping, the more surgeries we're canceling, then it was really a mind shift of, yeah, it's not an expense. We're helping more and more people. So I was really surprised about the results that we're getting. And when people are getting results, they want to do more. So I have patients that said, hey, I got this knee thing. You think you could do the knee? Hey, I got this shoulder thing and this elbow thing. And I have one patient right now that she's done 3 separate areas in the last two months. So we started out with one area, then she wanted another area, then she wanted another area. And so it really sells itself, because when patients get the results, they're willing to invest and do other areas with it. I would 100% recommend the OMNIWave to other providers. In fact, I've already sent 2 of my colleagues to purchase an OMNIWave because it's the best. It's the best in class. I've had other treatments done. My competitors have had other devices, and they don't compare to the OMNIWave, right? We're in this for the results. Yes, the money's great, the patients are great, the testimonials are great, but we're in it for the results. And my goal is to cancel as many surgeries as I can using the OMNIWave. And we've been able to do just that. And so if you're looking to step up your game, if you're looking to generate some serious revenue within a short amount of time, you don't look any further than the OMNIWave. This thing is an absolute stud. It's a workhorse. I can't recommend the OMNIWave enough. I know there's other devices out on the market, but in my experience, this thing is a cheat code, and I would 100% recommend it to other providers.